Thank you so much for joining. I'm Kimani, the co-host of today's show, along with Faith. I'm a family support specialist for the Mental Health Association in New Jersey. We are a statewide nonprofit organization that strives for children and adults to achieve victory over mental health and substance use disorders through advocacy, education, training, and services. The FOC program that I work through is funded by a COVID-19 grant for families of color to support families of color through education and advocacy, gaining awareness and getting access to mental health. So we want to welcome you to our first Engage. And I'm going to turn it over to Faith.
Thank you so much, Kamani. Well, I am so excited to be here myself. This has been a work in progress, and it takes a team to be able to pull this off. And so I want to thank everyone who has been instrumental in helping this to come together, especially the Mental Health Association, for actually hearing, really listening to what people have been saying about what their needs are. As Kimani mentioned, my name is Faith Saunders, or you may see Faith McCalla, same person. I'm one of your co-hosts for this initiative. And one of the key things that we really want people to walk away and feel safe about is that this program is for you. It is for you to be able to engage, to be able to share with us so that we can work in partnership, in collaboration to bridge the racial inequity gap that currently exists for persons of color. This program is a monthly program, and for each month, we're going to have experts coming on to actually give us information and share resources with us. Earlier, I was mentioning that in New Jersey, one of the things that we are gifted with is that we have a lot of resources. The sad thing, though, is that our resources are in silos, and what happens is that most of us are not even aware of what resources are available to us. To help the clients that we are actually serving. So our monthly program is for providers, for individuals who are working with individuals in the community, to be able to help them to be able to access the care that they may need, so that we can actually bridge that gap that currently exists. So without any further ado, I really want to introduce our guest. He's a friend. He's a friend and a great clinician. And Parantap Pandya has been working at the Mental Health Association for quite a long time. He'll tell you a little bit more about the initiative that he works on, and then we'll get into some questions about how do we start engaging individuals of color as it pertains to addressing mental health challenges that they may have. So, Parantap, thank you so much for being here today.
Thank you for inviting me. I think this is a very good initiative. It is going to give permission to a lot of people who are in the minority families of color community who may not be as comfortable coming out and talking about it. So I thought I'll take the initiative in saying that yeah, I come from a family where there are a lot of people with mental illness, and I studied psychology so that I can help myself and help them. And this is how we help each other. And I appreciate the forum that Mental Health Association has provided for us to have this conversation so that we can all learn to depend on each other, learn from each other, grow together, uplift each other. So I turn myself over to you, Faith.
Be careful what you ask for. So my first question to you, Parantap, is why is it so important to engage and partner with families when we're working with someone who may have a mental health challenge? Why is it so important to have that family involvement?
That's a great question. The way I come from India, so I look at everything from two lenses. One is from my country of origin, and second is living in the US. Individual consciousness has always been sort of recognized in US, and everyone is an individual. And people are seen as if they are living in a vacuum. Where I come from, we are all part of a system and a community, and we sink or swim together. So if the neighbor's house is on fire, it's a matter of time that the wind will blow over and my house will be on fire. So we all sort of recognize how interconnected we are. In the US, there is a certain portion of the mental health system that looks at the consumer as you are the individual and I only treat you and I only see you. And we have to change that paradigm. The 15-minute, or if you are lucky, 15 minutes, 5 minutes that a psychiatrist sees a patient, or the 45 minutes that a therapist sees a consumer. It gives them only a small snapshot of what's really going on with the client. The family is the first diagnostician. They are the first ones to recognize that, you know what, Junior doesn't look like he used to. He doesn't talk like he used to. Something is not right. It doesn't look like he's taking meds, not taking meds, not eating right, not sleeping right. Something is on his mind. He's not talking about it, but I feel it. Family has a wealth of clinical information. You cannot treat a consumer without taking into consideration the context in which they breathe, live, behave, talk. So why not take both? Take the consumer's information, have the family be involved. Families are your allies. Families are people who are going to follow through with whatever plans you make in treatment room. So include them and make this a collaborative teamwork. We all can pull together in the same direction, get better results, faster results.
Wow, I love that. You touched on a number of different things, Parantap. You talked about culture by comparing your culture to the culture that we have here in the United States. I'm from Jamaica. Again, different culture, how we see mental health and how we respond to it is different. And I think as providers of services, those are some of the things that we have to take into consideration for what the culture of this person is coming from, so that we can also approach the situation from a way that is comfortable for them. So that's, I think, where the cultural competency comes in terms of us as helping professionals being able to connect with individuals that we're actually serving. So when we talk about engaging, so it's easier said than done, right? Because sometimes from past experience working in the field myself, it's that you're working with someone and you have someone as a client, and the family members they are seeing stuff and they're maybe calling and saying, but sometimes you can't really talk with the family member without the individual giving you permission to do so. But even when you get that permission, how do you start bridging that gap to engage that family member in terms of being a part of the team?
Okay, so let's recognize how did we get here. Families, generally speaking, are not billable. If they are not billable and if there is no code for insurance companies and for hospitals, the professionals are not going to invest as much time and energy. They are encouraged, it is appreciated, but it is not a norm that each and every family at the time of treatment will be educated on what is your loved one's diagnosis, how does it manifest in their behavior at home, what can you expect if they take meds, what can you expect if they don't take meds, and how do you support them. When families are nagging, bothering, asking too many times, they are like, fine, and somebody will talk to them. And that has to change. And somewhere along the line, the yin and the yang of treatment is the individual and the family. Together, you can sort of make a real difference. So my first concern is that if you, as a clinician, as a mental health provider, healthcare provider, are uncomfortable with families, like you have your own internal bias, such as, oh, look who's here. Apple doesn't fall far from the tree. You think she's bad? You should have seen the mom. All those things going on in your head, it will show in your behavior. You should not go anywhere near the families unless and until you can be compassionate, empathic, and recognize that nobody asks to be mentally ill. No parent and brother, sister wants their loved one to be mentally ill, of them taking care of them and dealing with all the struggles. We need to have compassion for both. Nobody has caused anyone anything here. It is what it is. Now, you may cause stress, which can exacerbate symptoms, but that's where the role of the provider comes in, how to bring down the stress of that family so that they can be more compassionate with each other, empathize with each other, and support each other. So your own bias, you have to know about it. Second thing is culture. If you have a mindset about certain cultures, like this is how they are, even if you don't say it, your body language and your vibrations will give it away. So please have a conversation with your clinical supervisor or somebody to not have any kind of prejudice and preconceived notions of this is how they are. No, nobody is they. We are all the same. 1 out of 4 has mental illness. White, black, Indian, Chinese, you name it. And you know what? They all are struggling. I have seen rich people struggle. I have seen poor people struggle. I have seen people who are just fresh off the boat from India struggle. I have seen people who are second, third generation living in US struggle. We are all new to mental illness when it strikes us. We are all starting by learning, making mistakes. And what we need is those who are not in our shoes to imagine what would it be if I was in your shoes. I wouldn't know what to do. I wouldn't know what to say. I wouldn't know how to talk to a psychiatrist who doesn't return my calls. I wouldn't know how to talk to a crisis worker who is not agreeing with my concern that so-and-so should be admitted. It's a very challenging and a tough place to be. So don't make light of it. Don't minimize it. Don't discount and deny it, but slow down, take it in and be engaging. And here's where the engagement piece comes. Join with them. The way you join with them is recognize that, oh my God, really? Your son was in college and then he was brought home? Oh, that must be so hard on you. This is what happened to your wife. That's what happened to your brother, sister. I'm so sorry to hear that. It doesn't take a whole lot to be a good human being. You don't have to go get a master's or a PhD to be a kind, compassionate human being. We all got it in us. Apathy is the biggest problem these days. Empathy is the antidote. Compassion is the antidote. And being caring towards each other. Whether we like it or not, we all sink and we swim together. Those of you who don't believe it, look what happened with COVID. People who are having an infection, not taking certain precautions, spread it among others. We are all in this together, whether you like it or not. So it's best that we work with each other and we bring the best out of each other. It's in our hands to bring the best out of each other.
Wow. Well said. Thank you so much. That's why we had to have you on our first show because so much powerful information. Parentap, you touched on us. I love the fact when you gave an example of being just connecting with people, really, really meeting them where they are at. My son used to be in college. He had his first break when he was in college. I am so sorry to hear of how difficult that must have been for you as a family, as a family supporting him, etc. So being able to connect with people where they're at, that is really, really powerful. You mentioned also that in terms of, no, let me ask it this way, the question this way. I'm working with someone, and I notice this person is not their normal, the usual self. Let's take out the word normal because none of us is not normal. They're their usual self, right? And you have some concerns. How do you approach this topic? Because no matter what, it's still not a very comfortable topic for many people to talk about. COVID gave us a gift because now we're talking about mental wellness and everything is, self-care and all this stuff, things that we initially didn't even want to talk about. But it's opening up the giving us what we need in order to have that discussion. So I'm working with someone and I'm seeing that this person is having some challenges. How do I approach the family member or the person themselves in terms of really figuring out what is happening and engaging them in the process? Because we know that the research shows that the earlier the intervention, the better the prognosis, the end result in terms of how the person deals with their illness. So That's my question. How do you make that connection? How do you engage them?
Yeah, so first of all, when the family or anyone doesn't have a reference point, that there is no formal diagnosis, there is no documented history or somebody is educated, everybody is lost. We are like that proverbial 8 men who are blindfolded in a room with an elephant, and each one is touching a different part of the elephant and describing the elephant as the elephant is a wall, elephant is a pillar, elephant is a rope. That's how we are. Everybody is lost. Now, you or me are the providers who are able to see. We got the lights on and we can see what is happening here. So the first thing is gauge your own comfort level. Because if you are uncomfortable talking about it, you will make them uncomfortable, you will make them defensive, you will make them worried. You don't want to go there. What you instead want to do is connect with the family and develop a relationship. Why is relationship so important? I'll tell you why relationship is important. If I like my sister and she tells me to run an errand after it snowed and I have to clean up my car, we have a relationship, I will say yes. If we don't have a relationship, I will say, no, I got something else to do and I will somehow not do it. Relationship makes us go there and do things that we would normally not do. So have a relationship before you jump in. We are in a culture where everybody diagnoses too quickly. We go on Google or go on YouTube and everybody has become an expert. Please don't do that. Connect with the family. Make them like you. That's your job. Why would they like you? Because you care. Because you are a person who can tune into their frequency. And then you go to the diagnosis part by going around it. You don't attack it directly. Listen, you cannot throw this and rub it in anybody's face. We still, as a society, have a stigma. It is not easy for anybody to take it in and digest. So you gently reel them in. And my boss, Joyce Benz, is excellent at it. I have picked up in the last 15 years that you start by asking how they are doing, how they are feeling, what do they want for themselves, where do the family sees them doing well, not doing well, achieving, where when they were 15, where did they think they would be at 18 or 20 if they are, when they were in college, what did they think they'll do when they do work? You have to bring them to that point where they say, yeah, I kind of started my life heading towards Boston, and what am I doing in Virginia? And that's when you say, did you want to go to Virginia? No, I didn't. Okay, can we figure out a way how I can help you make a U-turn and go back to Boston? Oh, that'll be great. I'm talking analogically, metaphorically, but you get my point. The goal is to validate who they are, what their goals were, who they want to be, and then show them a map how to get there. And then just drop a hint. You know, talking to a counselor wouldn't hurt. If a person is totally resistant to medication, start with therapist. That whatever is going on in your life is stressful, distressing. Use words such as you deserve better. You deserve peace of mind. Don't you deserve an outlet? Like just take it out. Yeah, why don't you talk to a therapist? Maybe they can help. If a person is open to see a psychiatrist, great. Why don't you make an informed decision? You can always say no. Go talk to a psychiatrist. Tell them this is what's happening. I'm not sleeping. I'm not eating. I'm hearing voices in my head. That is going on. And it is upsetting to me because then I cannot do this. I cannot do that. And if the psychiatrist says taking a medication is going to help you, try it out. What are you going to lose? 1 month, 2 months, 3 months? If it doesn't work, you can always drop it. You have to make it so disarming and you have to make it so normalized. That if you have diabetes, you would take a Humulin. If you have blood pressure medicine, you would have if you have blood pressure problem, you'll take some medicine for that. It's just something like that. Let's not make too much out of it. You should not be suffering. You should be, you can be all you can be. And I want to help you get there. How can we work together here? Do you feel I'm respecting you? Do you feel I'm hearing you? Make sure your tuning in is good.
I
And
love that.
yeah.
Wow. Thank you so much, Parantap, for that. So, as providers of service, as we mentioned, everything is in silos. And one of the things, or one of the ways that I know that really helps in terms of bridging this gap is having a tribe. Having a tribe. I remember working in the field, and one of the things with having my tribe of providers or service community partners that I reached out to. So, for example, I'm working with someone and they had a question for Social Security. I had someone in Social Security that I know I could call and get the answer, because some places you call and you get 10 different answers, right, for the one question. So who can I start developing these relationships with so that I have a tribe, someone who can be here to support me? So Parentap, if you could actually share with us why is the tribe so important and how do we start getting there?
Okay, well, we as anthropologically, as the species that we have always survived in herds. And it is in herds where our greatest strength lies. When we create that interdependence and when we support each other, we have more for everyone. 10 brains are better than one. So why do support groups work so well? Why do support groups help so many people? Because we all learn from each other. My experience can teach somebody something, somebody's experience can teach me something. And if none of us have the answer, 10 of us do that problem solving together, and we can explore so many options that each one of us can look at it through a critical eye and say, you know what, maybe you should be doing this. And that's what happens at Intensive Family Support Services. By the way, Intensive Family Support Services is a grant-funded program by the state, has been around in Jersey over 20 years. Mental Health Association has had the grant for Atlantic and Union County for 15, 20 years. And we run support groups. The Union Mental Health Association, IFSS, runs 4 support groups in a month. One is a discussion group, one is a psychoeducation group, one is a sibling support group, because siblings have their own unique issues. They have seen parents do certain things that they are now inheriting, so they want to talk separately. And then there is just another discussion group. Sometimes we have spouses group. The goal is to make this a collective experience. Why isn't COVID affecting us, like, in spite of it being such a devastating impact all over the world? Because we all have it sooner or later. Somebody in our family has it, our neighbor has it. Because everybody has it, it doesn't hurt that much. The burden is shared. Same way, when 10 of us meet and talk about our collective struggles with our loved one or with ourselves dealing with a mental illness, suddenly the weight is lifted. We feel lighter. And I strongly encourage everyone to look into it. The Mental Health Association website has information about IFSS. NAMI New Jersey has information about intensive family support services. Don't take this on in isolation. It is too big of an issue. And if anything, this field has taught me is to be humble. When you think you know it all and you figured it all out, there is so much more. And that's why take all the help and the resources. The more you know, the less you will suffer.
Wow, wow, powerful. And we're going to be putting in the chat the resources that Parent Tap mentioned, the IFSS, because there's one in every county. So to be able to access that. Again, having someone that you can bounce ideas off, that is what gives us what we need in order to do the work that we want to do, the best job that we want to do. So Parent Tap, times go by when you're having fun. It really does. I could continue talking with you for the rest of the afternoon, I'm being honest. But at this point, we're almost out of time. My question to you is, or my thing, do you have any closing words for everyone that's here today as it pertains to engaging family members?
Yeah, I have more than that. I have an appeal because I have a daughter with mental illness. So for me, this is personal. Family members and me just connect because I get their world, they get my world. So what I see happening in the mental health system in New Jersey since COVID is that resources are less, demand is high. It's a tough time for everyone. Agencies are functioning with less personnel, and those who are there are having their own issues. They are not able to fulfill the staffing needs. So clients' needs are sort of not met many times. Uh, we need to start calling out mental health system. For example, why is it that private practitioners do not take people who have serious and persistent mental illness for the most part? I'll give you a challenge. Call 10 therapists and say, I have schizophrenia. I'm looking for a therapist. Do you have any appointments? See how many responses you get. You'll be lucky if you get a response. If you do get a response, they will say, but don't you think you need medicine? Because that's what you really need, right? But that's not true. Where we are leaving people vulnerable is that we are taking people who are not in reality, medicating them, bringing them in reality, and leaving them hanging. People are looking at all their losses and the carnage that the illness has taken in their life, and they have no one to talk to. And that is the reason there are suicides happening in the mental health in this community of people with serious and persistent mental illness. Due to lack of proper medication of the dual diagnosis, they tend to lean on drugs. And then the drugs can cause their own problems, sometimes addictions, sometimes overdose and death. We need to ask our policymakers for more, for better oversight. Like I ask you a simple question. If this was a privatized field, each and every screening center would have somebody who would be making mock calls to see what is the quality of service. Does that happen? It would be nice if it can be done, because what you want is there consistency across the board that anybody can call a hotline. It is so subjective that it could be picked up by a nurse, a nurse's aide, a psychiatrist, a screener. And then you have to ask, depending on what screener it is, it may be identified as a crisis, or it can be identified as a baseline. I mean, what are you going to do? I mean, call us when the person is dangerous to self or others. That's what many of them say. And I'm like, whoa, 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 we don't want that. We don't want the person to meet the criteria for you to get involved. We want to prevent it from happening. Can you teach them how to take action before that and do something preventive? But if there is no quality control, how can you improve the quality? Now, the person who are mentally ill have enough on their plate, so they are not going to march on to Washington. The families who are taking care of the mentally ill, they got enough on their plate. They are not going to march to Washington. So it is us who will have to do something about this. All our elected officials, policymakers, administrative staff will have to educate people to be better advocates and ask for more. There is enough out there. We just need more voices.
Awesome. Awesome. What a great way of ending this segment. Thank you so much, Parantap.